It's a pleasure. It's each time we know that your eyes are on Church of Uganda Family TV. Thank you so much for loving and watching Church of Uganda Family TV, and particularly Health Pod. Remember, this program is brought to you by Makerere University School of Public Health, together with Church of Uganda Family TV, and of course with me, Edwin Austin Mukala, as your host. Remember, the whole of this month, even as we head to the end of it, we've been looking at asthma, causes of asthma. We started with understanding asthma, what asthma is. Then we went to the causes, and the previous Friday we were looking at the treatment. Today we are here partly to talk about prevention, but also to respond to some of your questions. I'm glad that you are sending in your responses, your questions, and we are with Dr. Rebecca Nantanda, a researcher from Makerere Institute. She'll partly respond to these questions and also tell us how we can prevent asthma. But before we go into the depth of the topic, I request her to greet us. Doctor, we are again excited that you're here with us.
Thank you, Edwin, and good evening to our viewers. Thank you everyone who has been asking questions, and that really shows the interest in the topic.
Exactly.
And we are happy to respond.
And the questions are overwhelming. You look at the responses and you're like, I remember Dr. Christine in our very first episode said, asthma is a silent killer. Very many people are dying, but people have no solution. People don't know where to go to get the right information. And the response shows us that this is really true. People are anxiously waiting to know, to listen to information about asthma. And we are glad you're back again to talk about asthma. So, Doctor, on the way, we shall look at that. We shall be bringing in the questions of our viewers, but I think let's straight away go to prevention. I understand prevention is categorized into two. We want first of all look at how someone can prevent themselves from getting asthma, and then later on we shall look at how someone can prevent themselves from getting an attack, or they can prevent their children from getting attacks.
Okay, thanks, Edwin.
Yeah.
Getting back to the discussion we had about how asthma develops in people.
Yes.
And I remember mentioning that it's an interaction between your genes and the environment.
Yes.
So there are certain things we can do to prevent ourselves from developing asthma, even when you may have the gene.
Okay.
And that is something to do with the environment.
Before you go to the environment, someone asked a question and said, is there any test that can be done, genetic test that can be done to see whether I'm carrying this gene or not?
Yes, but those are not the tests we do in routine clinical care. There are tests that have been, the genes have been identified through research, so we know specific genes that are responsible for predisposing people to getting asthma. So that's why the researchers are going ahead to see if there are some treatments that are related to the genes that can help people with asthma. But when you come in a clinic, we are not able to test the genes and say, for you have the gene that is going to predispose you to asthma. That's usually in research settings.
Okay.
Yeah, but getting back to prevention.
Yes.
There are things that I mentioned that we call risk factors. The things that can easily make you get asthma symptoms even when you have the gene. And those are things within the environment. Things like air pollution. If you are staying in an environment where the air is polluted, there is a lot of smoke, either from cooking within our kitchens or from the environment, from the factories, from the cars, all those things. Once you have the genes, once you inhale those fumes, they start off that reaction because you already have the genes.
Okay.
So prevention of air pollution in our homes, but also in our cities, in schools, is very important in preventing somebody from manifesting the asthma symptoms.
Because sometimes you look at traffic congestion, and you realize the cars are parked and they're fuming out, and you're like, what can now someone do if maybe they're asthmatic and this is a trigger?
Yes, we usually advise, if you can, avoid streets or avoid times when there is really peak traffic. If you're able to close your window so that you don't inhale the fumes. So those are some of the things that you can do. And for the air pollution, it's two ways. It can, if you already have asthma, it can actually make you get an attack. Yes. But also there are other things within the environment I talked about, like allergens, the mold, the pollen, things within our houses that can actually start, if you're exposed to them, they make you get asthma symptoms. So trying to prevent development of asthma gets back to what are those things that actually bring asthma in the first place. And these are things which are commonly within our environments. Very important, I want to mention, we are talking about children in asthma, tobacco smoke. Please, parents, whenever you smoke, just know that you're predisposing your child to asthma. Tobacco smoke is so bad that if, for example, a pregnant woman is within the house where there is somebody who is smoking tobacco, that tobacco, the mother can inhale the fumes and they affect the unborn baby. So by the time that baby is born, the lungs are already kind of damaged, they're not functioning well, and such children are at risk of developing diseases like asthma later on. So when we're talking about prevention, it's prevention before birth, when the baby is within the womb, but also after birth, what you do within the environment to prevent somebody from developing the asthma symptoms.
Some parents, because the Bible says that men are the heads of the family, so they really want to share, they are the heads. Now they're smoking, and when they're smoking, he comes and sits in the living room with his cigarette. And when all the children are there, maybe watching TV and inhaling the smoke that he passes out.
I think that's not a smart way of being a family head. If you're a family head, you really want to protect your people. You want to provide for them, you want to protect for them, you want to make sure they live a good and healthy life. So again, my appeal is that do everything within your power to prevent your people from getting certain diseases. Tobacco smoke, beyond asthma, there are other so many things. Besides damaging you yourself, even the people who are within the environment can actually get diseases just because somebody else is smoking. So if you're a smart household head, it means you're going to protect your people, it means you're going to make sure they're healthy, provide for them, and if they have the symptoms that I talked about, make sure that they are able to access care.
Not a theoretical head. Well, Doctor, on that very point, someone asked a question and said, according to Dr. Rebecca's explanation, maybe all of us have asthma. But my question is, how much can it cost me if I want to come at the Lung Institute for a normal checkup? Just a normal checkup. They have not exhibited any symptoms, but they want to be sure whether they are not asthmatic.
So first of all, it's not that everyone actually has asthma, but we've done studies in different places in Uganda, and we know that at least 2 out of every 10 people have asthma symptoms. Unfortunately, over 50% of them do not know until we do a certain test and we tell them, you see, you actually have asthma. So we do the test that can help us identify people with asthma at the Lung Institute. And I want to say that the Lung Institute, much as we are called Makerere University Lung Institute, we are not situated on Makerere Hill. We are on Mulago Hill within the medical school. So when you go within the Mulago Hospital, the new hospital, you ask where is the medical school. And once you reach the medical school, when you ask where the Lung Institute is, you will be able to actually find us. Yes, so our clinic works every day from Monday to Friday. We open from 8 up to 5. It's a walk-in clinic, you don't need to book an appointment. And so when you come, like somebody who said they want to do a general checkup.
And Kennedy Mogisha in Barada also asked the same, was asking for the location, and I think the two are covered in one.
Yes, I probably maybe will provide my number at the end of the show.
Probably.
So that the people are able to call in and we direct them. Because it may not be easy to find for some people. So when you come, first of all, we assess you, and there is a specific test that we do. It's called spirometry. That's really a technical term. But basically, we are measuring the amount of air you're able to breathe in and out, and it can inform us how well your lungs are functioning, and if at all you have asthma. And it's a test which I think for now we are only able to provide within the Lung Institute. A few other centers are coming up. It costs 100,000. Of course, it sounds like a lot of money, but remember the journey of really making sure that you have the diagnosis. you have the test that has been done, we put you on the right treatment. In the long run, you actually save a lot because you no longer be buying medicines here and there all the time. So usually the first visit can be costly, but the savings come on later on when you realize you're no longer spending a lot of money on inappropriate medication, on hospital visits and so forth. Yes.
Okay.
Yeah.
Well, I think we continue with we get back to the prevention. We are still looking at how someone can prevent. I think what we are explaining was now preventing someone from getting attacks, especially if they are asthmatic. What else can they do besides exposing themselves or exposing them to the environment? Because you said most of these triggers are within the environment, what surrounds us. What about the lifestyle? Someone is asthmatic, but they want to go for nightclubs. They enjoy dancing. Can that be a challenge?
Yeah, of course it can be a challenge. So there is prevention where we're preventing somebody from actually getting the asthma symptoms. But if you have been diagnosed with asthma, there are things we teach you to prevent getting attacks. Remember, I mentioned that the more attacks you get, especially if you're a child, because children's lungs are still growing, so if you get a lot of attacks, it means that your lungs are being damaged continually. And later on, you get other diseases beyond asthma. So it is very important that we prevent attacks. And one of the main things that I want to mention that can help you prevent attacks is making sure that you take the medicine, the daily medicine, once it is prescribed. And in that show during treatment, I talked about the controllers or preventers, and I explained that daily medicine is meant to prevent attacks. So please, even when you feel fine, remember I said you may feel fine, the symptoms have gone, you're able to play all the sports, but the lungs inside there have not reached that point where we have controlled the inflammation that is usually responsible for the attacks. So please take your medication. We usually work as partners to reach a point where we say now you can stop the medication. So number one way of prevention is making sure that you take the medicines as prescribed for the duration that has been talked about. And that can only happen if you're able to keep your appointments and we keep discussing. So the other ways which we also teach you when you come to us about how to prevent attacks is to prevent exposure to the triggers. And most of these things are within the environment. And for children, it's either home, and if they are school goers, it's on their way to school or within the school premises. Most of the things I talked about, like mold, damp areas within the house, or if there is a lot of dust within the house, in the corners, do what we call clean house, major cleaning often, or with the windows. So that dust is a common trigger and many people ignore it. Cooking within the house. Cooking is good because we derive our livelihood from there. We eat, we have to eat food. But it can be dangerous if you cook within the house because the smoke that comes either from the charcoal stove or from the firewood, once it is inhaled, somebody inhales it, then they start getting attacks. Perfumes, insecticide spray, and all those different things. But all these things we are able to actually teach you, and you're able to identify them and be able to reduce your exposure to most of those
when
things.
They come at the Lung Institute.
Yes.
Okay, Doctor, let's shortly take a commercial break. We shall be right back.
Brethren, yes we can. We can clear the debt of church house. And I want to invite you to give generously to the love gift. May God bless you as you give.
Pulogulaamu ensonga tukuletera okumanya biki ebigenda maaso mu ggwanga. Okumanya ebyenjigiriza n'ebyenkulaakulana ekyo nikyo kikulu. tuliko wano ku Church of Uganda Family TV buli wa mukaaga essaawa 11 ez'akawungeezi.
Thank you so much for watching Church of Uganda Family TV, and thank you so much for following HealthPort. This program is brought to you by Makerere University School of Public Health, together with Church of Uganda Family TV. And the whole of this month, we've been moving with Makerere University Lung Institute, and in the first episode, we had Dr. Christine Shema, and we have now Dr. Rebecca Nantanda taking us through how you can prevent asthma. And doctor, on that very note, because before the commercial break you were telling us about what you tell parents to do, and then there is a parent here saying, I'm Lillian, a mother of 2, both of them are asthmatic. In moments of attacks, even when I use the medicine given to me, my children don't get any better until they are admitted in hospital. What could be the cause? I seriously need your help. I'm even scared of giving birth to more babies. They might be asthmatic as well. I think she has had this hardest moment of her life with her children. And what could that be? Is it that she's not administering these medicines the right way?
Okay, the failure to respond when somebody has an attack, either the medicines that are being used are not the correct medicines. Remember I said there are 2 types of medicines. Yeah. We have the reliever, which we only use during the attack, and then the controller. So if somebody gets an attack, the right medicine is used to be used is the reliever. And it should be an inhaler. Yes. So that's one thing. We don't know if she's using the right medicine to relieve the symptoms. But the second thing is that how you use it. Remember I said the problem is that the tubes within the lungs are narrow, and therefore you cannot breathe in and out comfortably. That's why people experience difficulty in breathing, or they say they are suffocating. So for us to give you relief using that reliever medication, we must make sure that the medicine reaches the lungs in the right dose. So if the children do not have spacers, that means most of the medicine ends in the mouth, even though she's using an inhaler, or even if it's the correct inhaler. So that technique of making sure that the medicine reaches the lungs where it is required in the right dose is possible if you're using what we call a spacer. So it is also possible that she has the right medicine, but she doesn't have the spacer. Okay. But there are some people who have both. You have the right medicine, you have the spacer, but how you use the spacer also is important, because that's the only way you can make sure that the medicine reaches the lungs. So again, when you come to the Lung Institute, we are able to take you through the session on making sure that the medicine reaches the lungs. So I would encourage the mother of 2, please, if you want more children, we can find a way, first of all, alleviating your anxiety, your distress, the pain and the suffering the current children are going through, so that their symptoms are controlled. And then I think that will motivate you to have more children, because then you will know that I can take care of them. Sure. Yeah.
Lillian, I believe you've had. So, Doctor, we get back to prevention, because I believe no parent would really love to see their child going through the attack, the asthmatic attack. So we really want to help our parents out there to see that their children, to see that these parents don't go through, first of all, what they go through when children have attack. Oh, someone might be watching, they are mature and they are asthmatic. So maybe they would also want to learn how can they prevent themselves from getting these attacks.
Yes. Yeah, like I mentioned, look within the environment. The things we talked about, are there those things within your house? Keep your house clean. We've had incidences. You see these carpets, beautiful carpets we have in our houses. They have a lot of dust. They keep a lot of dust, and there is something we call the house dust mite, very notorious for causing attacks. So we've had to negotiate with the parents to make changes within their houses. Roll off the carpets and keep them. Make sure that you clean the house so that there is no dust. If you are cooking within the house, get a kitchen or transfer. There are some parents who have to let go of their very nice perfumes because the children or themselves react to the perfume. So there are these different modifications which you have to make. At the same time, you are taking your medication, because taking medication alone is not sufficient. It would be like the medicine is trying to control, but the triggers are ongoing, so it's kind of a fight.
I'm looking at a situation when someone asthmatic is seated in a taxi, and then someone with this strong perfume enters, and then this person starts responding what our president used to call sneezing out, they start doing that. Could that be a symptom?
Yes, it can be a reaction to the perfume. Now the good news
as a result of asthma?
It could be, or some people have allergies of the nose, and that can be a symptom. But like I mentioned, there are so many people who have asthma, but they also have allergies of the nose. Now the good news is, if you're on the treatment, the controller, the preventer, which controls the irritability or the inflammation, one of the things that happens is that you stop overreacting to some of those triggers. But this is not to give you a go ahead and say, okay, my symptoms are controlled, then I can expose myself to the triggers. You still have to make sure that you reduce the exposure. But if you're on medication, you may be in the company of somebody who has a strong perfume, but will not end up in an attack because the inflammation is controlled. And that is the beauty of making sure that you have your medication and you're taking it correctly, because eventually the attacks actually disappear and we even take you off the medication. So again, one of the ways of preventing those things is to make sure that you have your medication. Yes.
I'm also looking at a situation. These days it is a little cold, and coldness is one of the triggers to attacks. So I'm looking at someone who is asthmatic, and it is cold. They have to bathe. What do they need to do? Because someone will take it as an excuse. No, when I bathe, then I might get an attack.
Yeah, it's true. For some people, cold water or just the cold environment is a trigger for attacks. Again, we individualize. There's some people where cold may not be a problem, but other people when it's cold. So first of all, we let you know that you have to prevent from getting cold. We usually let you know that if you see the clouds gathering, just get your sweater even before it starts raining, because the moment you get cold, then the reaction starts. So prevention means that you keep warm all the time. There's some people where we've had to go an extra mile. The parents are very innovative. They say in the morning, maybe I make sure she bathes with cold water, or I just maybe wipe or bathe just halfway, and then I make sure she's warm and things like that. So once we are working with our parents, or if they are adolescents, we can actually find out something that works for each individual, because everybody has different situations. So we discuss with you within your environment, what can you change, how can you do things differently so that you prevent or you avoid exposure to the triggers.
Okay. Yeah, because someone will tell you, when I bathe with warm water, then my body becomes cold immediately. And
so ideally, when you bathe, you should wipe. Once you wipe yourself, then the body keeps warm. Yes.
Well, I think we get back to this question as well. Thanks for the show. I find hardship in breath when it rains, but I also have severe back pain from this talk, and those are the previous talks she was referring to. I'm afraid I might be having asthma. What can I do? Is back pain associated with, because she says in the first place she has had hardship in breath, and then back pain is also another. Could it be in any way a symptom of asthma?
Probably not, but it could be associated with what goes on when somebody has asthma. So many people, when they're having that suffocation, when they can't breathe, they tend to bend forward to try and breathe better. It's just one of, actually, if somebody comes in, the way they sit in the chair can tell us how bad the attack is. So probably that person is constantly getting, these repeated attacks, and then most times they have to not take a posture that is really bending forward. And we know that if you're not seated upright most of the time like this, then you will get back problems. So it could be associated. But remember, I also said that one of the symptoms of an attack or asthma is when you have chest pain. So I don't know that she's talking about really backache or really feeling the chest pain. There is the front and then the back. So if she's feeling the pain within the back of really where the lungs are, it could be that actually that's because of asthma. Okay. So again, the best thing would be that she gets care, she gets assessed properly, and then we find out if she has asthma. If there is something else that is related to the back, it's also treated, so that at the end of the day she's able to have a quality of life, which is good. Okay. Yeah.
So someone is greeting us in the name of Jesus and saying, Dr. Christine Shema talked about substitution of inhalers with drugs. Who qualifies for these drugs? Because I think I've overused the inhalers. And in the same development, someone also was talking about the effect of inhalers when they leave any damages in someone's body. So I think we can wrap up the two together. Okay.
So first of all, inhalers do not cause any damage once we teach you how to use them. And like I mentioned, you don't have to use them for the rest of your life. The problem comes in if you're not using the right inhaler. If you're not using the controllers, the ones that prevent attacks, you end up using only the reliever. So you tend to overuse, and reaches a time when even when you use that reliever, it's no longer working because the lungs are damaged. Okay. So it's important to have the correct medication. So there is nothing like I've overused the inhalers if they are being used correctly. At what point do I stop using the inhalers? Yes. That is an assessment we do, the patient and us, the providers, and we determine that now you can stop using the inhalers. Okay. Alternative medicines, occasionally we may give tablets, especially to children, but we do an assessment. There are so many things that we consider. Is it the cost? Will you be able to actually understand and make sure that the technique we are teaching you is okay? So we assess you as an individual and we see what is really best for you. But like I mentioned, the best option is actually the inhalers.
Okay. Well, thank you so much, Doctor. And as we conclude this, as we wrap up the whole topic that has taken us through the entire month, what is your last message to our viewers out there on asthma?
First of all, I want to thank the viewers for really listening in and the important question that have been asked. And I want to encourage each one of the viewers, if you find that your child has those symptoms that I talked about, please make sure that you take your child for assessment. There is medicine that can help children with asthma live a normal life, so that they are like any other children. They can realize their potential, they can get the grades that we are looking for, they can practice their talents of sport or singing or whatever it is. So my message would